Hello, my name is Mara Flynn, and I'm an undergraduate psychology student at Ohio University. Today I'm going to be talking about neuropsychology and its correlation to traumatic brain injuries. This is just a quick overview of the information that we'll be going over today, as well as my resource page for where I got my information. To begin, we're going to start answering the question, what is neuropsychology? There are two definitions to neuropsychology. For our purposes, we'll be going over the clinical definition, which states that clinical neuropsychology is concerned with the assessment and rehabilitation from brain injuries that impairs an individual's normal ability to function. Next, we're going to answer the question of what is a traumatic brain injury? A traumatic brain injury, or TBI, is defined as an injury to the brain that is caused by an outside force or trauma. TBIs can have short-term or long-term effects depending on their severity. There are many things that could cause a TBI, although the leading factors include falls, blunt force accidents, especially in sports, car accidents, and assaults. The symptoms and long-term effects of TBIs depend greatly on their severity. There could be physical symptoms such as headaches, cognitive symptoms such as loss of consciousness, confusion, and trouble remembering, and perceptual symptoms such as dizziness, the ears ringing sensation, and mood swings. There may also be short-term and long-term effects of a traumatic brain injury. More short-term effects include mild concussions, whereas long-term effects can ultimately lead to dementia. This table provides a quick overview of several types of TBIs, their names, descriptions, and causes, as well as if it's a primary or secondary injury. Just to go over a quick couple of TBI statistics, men are 2 times more likely to have a TBI than women are, and while falls are the leading causes of TBIs, vehicular accidents are the leading cause of TBI-related death in children and young adults, and in the United States alone, 2.8 million individuals get a traumatic brain injury every year. Lastly, we're going to talk about using neuropsychology to treat traumatic brain injuries. This page goes over several different ways that neuropsychologists may help their patients with a traumatic brain injury. Neuropsychologists may refer their patients to different rehab centers, such as physical therapy, cognitive therapy, and occupational therapy. They may recommend environmental change, such as staying away from computer work and on your phone, especially if it strains the eye. Lifestyle changes, such as limited drug and alcohol use, as well as hydration and nutrition, as well as sleep levels, may also be recommended. Finally, neuropsychologists may recommend different forms of medication, such as antidepressants and diuretics. Lastly, we will go over my resource page to show where I got my information from. Thank you for listening to my presentation on a STEM topic that I'm very passionate about.